Is there a geographic spread of these, or should we not worry about that? I've heard that the regions affected are kind of growing. So are there hot spots, or is it something like, hey, I live in Colorado, I don't need to worry about histoplasmosis?
Yeah, so the regions are definitely growing. There are specifically locations where they in the old days they used to be referred to as endemic areas. I don't like that term for many reasons. I prefer the term to describe those areas as hyper endemic. So histoplasmosis has now been found to be on all of the continents. It's been found in North America, South America, Europe, Africa, Asia, Australia, and it's actually even been found on Antarctica in the penguin poop. And so, if it's present on all seven continents, it's kind of everywhere. There are areas where it's present a lot more, and in those areas, you are at much higher risk. And for histoplasmosis, that would be pretty much everything east of the Rockies. The areas around the Ohio and the Mississippi River Valley are what we call really hyperendemic. They really have high rates of disease. But we see it in places that are commonly considered to not be part of the endemic area, such as the New England area in Florida. Um, for blastomycosis, it's also the Ohio Mississippi River Valley, but it also includes the St. Lawrence Riverway up into Canada. And our understanding of the spread and localization in Canada is actually pretty weak. And I wish we knew more, and I wish we could find out more about these diseases because I believe that they're probably more widespread than we think they are. With that said, our work and our group and other groups as well have done quite a bit of work to look into where they might be currently. And what we are finding is that they are in different places than we thought they were. And as we see more changes to the world as part of the built environment. We're changing the world by redirecting rivers. We're changing the world by building cities, etc. There's also a change in our climate, which is changing rainfall patterns and things like that. We are probably going to find it in different places. And so while those clues can be very helpful, it is also very important for both physicians and patients to keep an open mind about possible new areas.